So, yeah, welcome everybody. It's the 12th of October 2023, and I'm absolutely delighted to have Paula Jardine with me today because Paula has done some of the most remarkable research on the origins, in particular the historical perspective and the ongoing COVID project, and many of the complicated and troubling issues surrounding that and the vaccine program. And although I think you did a six-part series really covering this in the Conservative Woman website, I don't think that enough people are aware of your work. It merits far more people to be aware of it. And hopefully today can give you the opportunity to explain, hopefully in relatively lay terms, to more people what was really behind this, and in particular that historical perspective. But before we get on to that, if you can just give a brief introduction as to your background and why you came to be looking at this material.
Yeah. If I go right back to the beginning, I have a history degree, studied history at the University of Toronto, and I specialised in imperial history, and sort of nationalist reaction movements was my area of interest. But I hadn't really done anything as a historian. I trained as a journalist afterwards, hadn't worked as a journalist or done anything historical until all the COVID stuff happened. And then I sort of found myself in a position where I knew something was wrong, and I started just researching for my own interest first, and I was getting a bit frustrated that some of what I knew was happening wasn't in the public domain. And I was frustrated. And then it just occurred to me one day, well, you're a trained journalist, do something about it. And I just happened to have a combination of the research skills and the writing skills, and a background that equipped me to understand things from a slightly different perspective. And it moved things away from a lot of the scientific debate, which I sort of felt was becoming very bogged down, because you had two very entrenched sides, and it was quite technical arguments. It was difficult to cut across for a lot of ordinary people. So that was kind of my starting point. It was like, how do I find some ground here that opens people's eyes up to some of what was going on? So that's where it started.
Okay, so tell me about the Manhattan Project. I mean, most people, I guess, will be aware that the Manhattan Project was the World War II nuclear development project. So explain what it's got to do. What has any of that got to do now with COVID and the vaccine program?
Well, what I discovered is that since about 2005, in the aftermath of 9/11, there's been a small group of people from the biodefense community who have had aspirations for what they termed and were calling openly from about 2005 a Manhattan Project for biodefense. And the Bush administration had a very aggressive doctrine that they introduced in about 2004, which technically speaking violates the 1975 Convention on Biological Weapons. And they had this idea that you needed to defend against bioterrorism by doing your own bioweapons research and then developing countermeasures, so vaccines and therapeutics, to defend against this hypothetical threat. And it was part of what the Bush administration defense doctrine called full spectrum dominance. So thus we have things like this project to go out and find viruses anywhere that the US military might want to be planning for future operations, just as a preventative measure. You know, some of it is quite right out of the science fiction pages of something like Dr. Strangelove. When you look at it, and it just doesn't make any sense at all. You're talking about throwing billions of dollars at research for products that don't have a natural market, and therefore there's no need for them. But there is this aspiration to have them inside American government, and it's been enshrined in their policy via a series of presidential directives. So back in 2015, what I uncovered in the research was that this idea of a Manhattan Project had been kicked off again. So if you remember it was 2014 when the Obama administration imposed a moratorium on the gain-of-function research. And all of a sudden in 2015, they're talking about this Manhattan Project again and wanting to have prototype vaccines for 28 different classes of known biological pathogens and rapid response vaccine platforms like the mRNA and DNA vaccines that could be tweaked and rolled out within a matter of weeks on the general public. In 2015, there's a man named Dr. Robert Cadlick, who is really the principal architect of US 21st century biodefense policy. And he was the director of biosecurity policy for the Homeland Security Department in the Bush administration. From just shortly after 9/11, I think he immediately was called in. He'd been a bioweapons inspector in Iraq in the 1990s. He's a US Air Force surgeon. And a lot of this policy that we're seeing now has its origin, is policy that he developed back then. But by 2011, he'd gone to work as
just to clarify that, do you think that there was a genuine concern arising out of the fear of somebody like Saddam Hussein to actually use bioweapons against the US? Was that the motivating factor, or was it something else?
That was the excuse. And I was working on a story this morning. I'll just read you a quote that I'd come across. So this is from a 2005 paper. And somebody was examining this rationale, a guy named Milton Lightenberg. And what Lightenberg says is, well before October-November 2001, the spectre of bioterrorism benefited from an extremely successful sales campaign. Between 1995 and 2001, the most common portrayal of the potential for bioterrorism was the facile catchphrase, "It's not a matter of whether, just when." This proved to be one of the most successful catchphrases since the old soap powder advertisement, "Daz does everything." So it was very much an oversold threat.
Okay, if they genuinely didn't believe it, I guess this sets the core of the whole vaccine program as well, obsession. What was the objective? What's behind it? If they knew it was always something else, what is that something else?
Well, I think there are two things. So there are probably a few people right at the core of this that genuinely believe in the threat. And they talk about, there was lots of talk at the time about, a lone wolf bioterrorist knocking up some novel pathogen in their garage and being able to use it as a weapon of mass destruction. But my research suggests that one of the motivations at the time was to benefit certain pharmaceutical companies in the United States, Emergent Biosolutions being the principal one.
And there was some Robert Cadlick connection there?
Yes. So Emergent Biosolutions, they manufactured smallpox and anthrax vaccines. Now, smallpox was withdrawn from the market in 1980 because it was very dangerous. Anthrax was used on soldiers during the Gulf War, but there's no real need for civilians to be given an anthrax vaccine. But Cadlick was very successful in getting billions of dollars, and he stockpiled all these vaccines for the US government under a project called BioShield. And I think one of the other motivations is that one of his fellow Iraq weapons inspectors was a former bioweapons researcher for the US, a guy named Dr. William Patrick, who died in about 2010. William Patrick happened to have 5, I think, patents on advanced anthrax vaccines, conveniently. And of course, under provisions of something called the Bayh-Dole Act of 1980, US government scientists are eligible to be awarded up to $150,000 a year in royalties as part of a profit sharing agreement with the United States government if their intellectual property is commercialized. So if you're a retired former serviceman or bureaucrat, that's a nice tidy little sum of money. And if you've got that repeated 5 times, because you've got 5 different different patents, that's a very generous government pension, or supplement to your government pension. So I think there's a mixture of for some of them there is a genuine paranoia that exists, but there's also self-interest, and there's commercial interest as well. And it happened that in 2015 Cadlick was working as a consultant for Emergent Biosolutions, and what he did was he set up what he called a bipartisan biodefense commission. And they were looking at how to update American biodefense policy. One of the things up for discussion right back in 2015 was this Manhattan Project for biodefense. And it was like meant to be a big bang, and you could kind of roll everything out all at once under, well, clearly the way it's happened, under an emergency or a contrived emergency, where you're able to loosen government purse strings and get the money for this. So they happen to have had a forum in July 2019 discussing this Manhattan Project for biodefense. And Cadlick had been busy because he was by now back in US government as the Assistant Secretary for Preparedness and Response in Health and Human Services. And he'd spent his time since he arrived in 2017 working out how much money he'd need and where he was going to get it from. So he already knew he needed about $20 billion, which is about what they spent on Operation Warp Speed.
So we're talking specifically about the use of mRNA technology for this purpose, yeah?
Yeah, mRNA seemed to be the great hope. So they had a few other projects. There was a MERS DNA vaccine that they offshored during the moratorium. They partnered with a South Korean genetic company to develop that, and that had just been trialed in the summer of 2019, and then it was one of the ones that they tried to repurpose into a COVID vaccine in January 2020. Okay, so the mRNA was the big one, though.
Okay, so there's all this activity then going on in 2019 before there was any so-called the COVID, the SARS-2 stuff was actually around. So are you suggesting that they were looking for a convenient new virus on which to test this all out and to make massive profits? Is that basically what you're saying?
Absolutely, 100%. And my basis for saying that is that I spent a lot of time investigating the Moderna vaccine in particular. That was the one I started with. The initial red flag for me was that on the day that MHRA authorized the Pfizer-BioNTech vaccine with the temporary supply authorization.
We're talking about in the UK.
In the UK.
So, yeah, because people from America might not know what that is. This
so,
is the UK Regulatory Health Authority.
Yes, our enabling agency, as the CEO describes it, quite inappropriately, in my opinion. They kicked off the whole COVID vaccine campaign by issuing this temporary supply authorization. And And what I spotted was that on that day, Merck, known as MSD in Europe, who are one of the big players in the vaccine business and have produced some of the best known vaccines that are in common use. So measles, MMR, those are both Merck products. The polio vaccine was another one. They're a long-standing and big player in the vaccine game. And on the day of the mRNA announcement, they put out a very terse press release saying that they had divested from Moderna.
That
I
is
thought, oh,
interesting. Yeah.
this is a bit odd, because this is when
But
the
what was
profits are
there? What
about to
was there?
roll.
When you say they're divested, what was their financial interest in Moderna?
Well, if we go back to 2015, Moderna and Merck had entered into a collaboration agreement, and they were to develop a number of vaccines against infectious diseases. And the one that they talked about publicly, which was the front runner, was against respiratory syncytial virus, RSV, which we're hearing a lot about at the moment because that's the next one they're trying to roll out. And they also claim to have been developing a shingles vaccine. And I thought this is very odd. I went back through all their regulatory filings with the Securities Commission in the US, and I got to May 2019, and I discovered that Merck had handed back the rights to the shingles vaccine to Moderna, because they'd taken it was a 50-50 partnership they had. So the agreement was that Moderna would develop these mRNA vaccines with support from Merck, and then Merck was responsible for marketing and commercializing them as an established player in the market. That was the plan.
Right, because at that time, Moderna had never successfully brought a vaccine to market. Is that correct?
Yeah, that's absolutely correct. And the products that they were trying to get to the market had proven to be quite dangerous. They were rare disease targets and cancer targets. So nothing was happening very quickly. But in this regulatory filing, not only did it say that they had handed back the rights to this shingles vaccine, they had also released Moderna from an exclusivity provision in the contract with respect to a specific family of respiratory viruses, which is quite obfuscatory language. And when I looked a little bit closer, what I noticed was that the number for this vaccine, the shingles vaccine, was mRNA 1278. Now, when they rolled out their COVID vaccine, that was given the alphanumeric designator mRNA 1273. And the next one that they produced was mRNA 1283. So in the middle of this is something that they're saying is a shingles vaccine. But it's breaking up the sequence of their coronaviruses. So I was suspicious. And I went back a little bit further through the contractual documents. Now, they're quite heavily redacted in the Securities Commission filing, but they're still there. And I found one in an annex where Merck had agreed in January 2016 to substitute VZV for something else. Now, it looks to me as if it was a MERS vaccine, but at that time, because of the gain of function moratorium, there was a pause on clinical trials in the US on anything MERS related. And the RSV design uses vaccine is designed with the same IP from the National Institute of Health. So it uses stabilized spike protein design as well. And what it looked to me as if they were doing was they were using that as a forerunner. And they had tested that RSV vaccine in Australia in 2018 in people in a phase 1 trial. And about 6 months after they'd substituted VZV, there was a second amendment to the collaboration agreement with Merck. And Merck had managed to get them to agree that Merck could nominate its own candidate vaccine under this collaboration, and it could run the clinical trials itself. So that was another big red flag for me, that Merck clearly didn't entirely trust Moderna as a collaboration partner. So they'd started a second trial on a slightly different RSV vaccine candidate. And when you look at it, there's something, again, it's buried in the Securities Commission filing. Moderna had reported in its prospectus in 2018, when it launched on the stock market, that in that trial of the RSV vaccine in Australia, there had been one death. So this is in the period 1 month to 10 months post dosing in this phase 1 trial. They had 15 serious adverse events in 9 people and 1 death. And amongst those events, you had a stroke. There were somebody who had paralysis in part of the GI tract. There was I think the death was from a cardiac arrest. And of course, they're all dismissed as unrelated.
Did any of the 9 not have a serious adverse reaction?
Well, some of them were torn tendons. And I initially thought, oh, well, we can dismiss that as unrelated. But now I'm not so sure, because of something I saw in a recent Substack from a Midwestern doctor who had put together a very long article, and it was detailing all the individuals and the serious adverse events that that doctor was able to learn about with 1 degree of separation from the person who had the injury. And it does seem that tendon swelling is a problem. So it may not be as unrelated as I thought, but there clearly were issues. So there was a big question in my mind about what Merck knew about the safety of these things, because they were running 1 million miles and they weren't afraid to tell people on the 2nd of December that there was a problem.
Yeah. So they really wanted to distance themselves completely from this. And okay, so you focused on Moderna rather than Pfizer, but I think you've also got evidence that Pfizer was preparing a vaccine for COVID before COVID apparently existed, right?
Yeah, I've just started looking into Pfizer. What I discovered a few days ago via a link on Pfizer's own website, which takes you to their clinical trials paper, which was published in a journal under Paulas. If you actually look at the bottom of the header on that page, that gives a document date of the 5th of December 2019. I was like, well, isn't that interesting? Because that's 3 weeks before China knew anything about this pneumonia officially. And it's also the same time period where Moderna was getting ready to send a prototype of their vaccine to Dr. Barrick, because there's been some impropriety there as well. They sent a prototype under a material transfer agreement to Barrick on the 12th of December 2019. And the transfer agreement says that it is for mRNA coronavirus vaccine candidates jointly owned by the NIAID and Moderna. Now, the official explanation is that this is a MERS vaccine. And of course, they were developing a MERS vaccine, because after they extricated themselves from the contract and the exclusivity provision with Merck in May 2019, they entered a research collaboration agreement with the NIH on a MERS vaccine, which they've tried to make it look as if they'd been doing for a couple of years, but they cannot have been doing because of that exclusivity provision. So yeah, they had a prototype which they sent to Barrick in December, and they disguised the animal model to be used in the study. And I was a bit, that was another red flag for me. It was like, why would you need to hide the identity of the animal model? So clearly an indication that there's something not right here.
When you say, can you just explain what you mean by that, hide the identity of the animal model?
Well, there was a redaction on the first page of this material transfer agreement. And what had been redacted was the animal model that Barrick was to use for testing.
What do you mean by the animal model with it?
Well, he was doing some of the preclinical studies for them. And the standard model for preclinical work in coronaviruses is mice. Mm-hmm. So a murine model. And he's developed special humanized mice for exactly this purpose. So there shouldn't be anything contentious there. World-leading coronavirus expert does animal research in mice. But rabbits are actually not a suitable model because they don't develop symptoms in response to coronavirus infections. And that's been known for a very long time. And it was known to the NIH because they commissioned some of the research. But what they do is generate a very good antibody response. And what I discovered again in the securities filings was that they'd promoted a February 2020 share issue on the stock market when the COVID vaccine program was just started, by saying, oh, we've got this MERS vaccine in development, and look at these amazing results we've got from this rabbit study. And they don't identify the alphanumeric number for that vaccine.
So you believe that when they basically redacted the information about the animal model, it was they were hiding the fact that this was basically tested on rabbits rather than...
It was a fraudulent test. And it's been used to secure their IP. So they used it for their patent application.
Tell us a bit more about potential corruption or whatever, call it what you like, about the actual trials themselves, be it Moderna, Pfizer, or have you done anything on AstraZeneca?
No, I haven't really looked at AstraZeneca, although that had a precursor as well. So one of the things I was looking at recently was there's been all this attention on the proximal origins debate about where SARS came from and the gain of function research, which goes back to that mad rationale of if we can identify every virus on the planet, we can develop vaccines in advance. But what I also discovered doing that research was that the US biodefense community were offshoring the MERS vaccines and the MERS therapeutic projects during the moratorium because the FDA wasn't allowing them to run clinical trials in the US. So CEPI, the Coalition for Epidemic Preparedness Innovations, was set up, I believe, to get around that moratorium. It was an insurance policy. So they were replicating their own domestic research agencies like BARDA and DARPA, who were heavily involved in advanced vaccine research. And they were offshoring these American-designed vaccines to overseas partners where there were no restrictions on them doing the trials.
Presumably some people like Bill Gates were involved in insurance.
Well, Gates was involved in the establishment of CEPI. So the funding came from Gates and from the Wellcome Trust.
Mm.
And of course, that was Jeremy Farrar again. It also had funding from the German government, the Norwegian government, and the Indian government to begin with. So it didn't have masses of money when it was rolled out in 2018. But if you look at the things that Gates was saying at Davos that year, during the launch, he was talking about these mRNA vaccines and how it was just like software, and you'd be able to prove the vaccine was safe and then just change the information and you could do anything with it. He was actually asked, well, don't you have to make sure they're safe because you're giving these to healthy people? And he said, well, you wouldn't want a lower standard than you have for a cancer drug. And of course, that's what they were. They were repurposed cancer drugs. Mm-hmm. And interestingly, in some of those press conferences, he was talking about viruses that might emerge in food markets in China, which seems a little bit suspicious in retrospect.
So clearly, I mean, again, it comes back to this thing. This was you clearly believe, based on your research, that the COVID virus was essentially a key part of the plan to push forward the Manhattan Project for vaccines, a program to kind of like mass vaccination of the whole world then. But then why? Well, again, it comes back to this thing. What was the ultimate objective for this, and who were the real people behind it if it wasn't just these vaccine companies seeking, and the individuals who had the relevant patents, stuff like that, seeking to make big money from it? Was it just the financial thing, or was there other motives? Like people have said that Bill Gates, and he certainly said things which are consistent with this, that there is some kind of a depopulation agenda associated with it. Is it that? And if so, who else is involved in it? Who are the real villains here?
Well, if we go back to, if we just take the vaccine strand initially, so how we've ended up in a place where universal vaccination became a thing. And that happened in 1984, and it happened via UNICEF. But the organization that was pushing it was the Rockefeller Foundation. And that started in the 1970s. The World Health Organization at the time was led by a Danish doctor named Halfdan Mahler. And Mahler was a big advocate for, he was a tuberculosis specialist. And what he was advocating under the slogan of health for all was improved sanitation, clean water, better nutrition, all the things that we know make people healthier and have reduced disease incidence through the 20th century. And
which many, of course, have argued is the real reason why these diseases went down, nothing to do with the vaccines, the timing.
Yeah, absolutely. And there's plenty of evidence for that. If you go and look at Suzanne Humphrey's books, they've got wonderful graphs in there where they've gone through the statistical records and mapped everything out. And it does show that the vaccines were introduced when the disease incidence had dropped to almost nothing.
Yeah. Anyway, interrupted you
but
about.
If we go to the Rockefeller Foundation in 1978, they put out a paper basically attacking the World Health Organization approach and said, "Oh, this is unrealistic and too expensive. Nobody can afford this for the developing world. We'll give them what they were calling GOBI. So we'll teach them how to monitor babies for growth so that they know if they need to be fed more," which is all very good and well if you've got food to feed them. We'll give them immunizations, encourage breastfeeding, well, there was something else as well. And what the Rockefeller Foundation did was they installed one of their trustees into the executive director position at UNICEF. And by 1984, he'd basically worn the WHO down, and they'd inserted the word universal in front of immunization. And all of a sudden, everybody everywhere was supposed to have as many of these things as you could have. So that's kind of the precursor. But before the Rockefeller Foundation ever got involved in global health, they had a global population research team, and they'd been arguing since the 50s that the world was overpopulated and we needed to do more to reduce that population. So there is an intersection there. In terms of it, going back to the origins of this project and the Bush administration, it's very much this is leftover business for the Bush administration Homeland Security people. So Kadlec was a director of biosecurity policy. Dr. Richard Hatchett, who was is now the CEO of CEPI, which was set up in 2017 to get around that moratorium. He's a former director of Homeland Security Policy. And if you remember the good old Diamond Princess, which is where the whole myth of asymptomatic spread comes from, the two doctors, American doctors who were on that ship were Michael Callahan, who was the DARPA project officer who first came up with what he called the Inner Armor program, where they were trying to make these advanced vaccines. And another doctor named James Lawler. And James Lawler was the successor to Richard Hatchett as Director of Homeland Security Policy. So here you have the three Homeland Security directors of biosecurity policy, and they're all involved in that early stage of COVID.
Are you telling me something I didn't even know? You're saying that two of them were actually on the Diamond Princess?
Yes, that's who was sent in.
They just happened to be taking a cruise at that time.
Well, no, they were sent in once it had been quarantined to manage the evacuation of the Americans on the ship.
Yeah.
And two CDC officers had been sent with them, and they wouldn't let them board the ship with them.
Right.
And it was during the second week that they suddenly decided they were going to test everybody, whether they were sick or not. And the next thing you know, it's like, oh, it's everywhere. We have asymptomatic spread. So that's where that came from. So to me, it's and they were all part of a group that's been written about by Michael Lewis called the Red Dawn Wolverines. So we know about the proximal origins email chain, but there was another email chain, and it was all these people, and nobody's taking this seriously. This is like 1918 all over again, and millions are going to die, and Chicken Little running around catastrophizing about everything. Yeah, and I think it ties in. I think the vaccine passports are a very big part of this, and that agenda, which has kind of gone off the radar a little bit. People aren't paying as much attention. But I think
clearly making that a long-term objective. So yeah.
But I think that ties into something that they were trying to do during that post 9/11 period. The Americans had a project that they were calling the Total Information Awareness Project. And the idea behind it was that you had a digital signature for every person on the planet. And you captured every single piece of information about that person in perpetuity. And the vaccine passports, I think, are intended to be a gateway to that.
I certainly think, I'm convinced that the vaccine mandates and then passports were part of a long-term plan for sort of international digital IDs and that type of control. But it comes back to that question again. But then who ultimately really benefits from this? These are a level way above the kind of individuals you've been talking about. They're way actually above even the WHO. It's the Davos. It might even be above the Davos level, because clearly all of the Davos players are bought into that vision, because it's also part of Agenda 2130. I mean, there's no doubt about that. But,
and those are also Rockefeller agendas.
right. So it's the So the Rockefellers. So does that mean that Rockefellers and that there are some people, that those ultimately are the people dictating this, effectively the new world order, because that's what we're talking about here, isn't it?
Yeah. The Rockefellers, again, through their trustees who were installed in international agencies, were responsible for what's now Agenda 2030 and Agenda 21. So Agenda 21 came out of the 1992 Rio Earth Summit.
Yeah, that's the sustainability, under the guise of just sort of sustainability. Yeah.
Well, and the person that was most responsible for that was a trustee named Maurice Strong.
Oh, yeah, Strong. Yeah, yeah.
And but it built on the work of the Brundtland Commission. And she's an interesting character who goes completely under the radar because she keeps turning up. I call her the Grey Lady. So the former Norwegian Prime Minister, Gro Harlem Brundtland, who was also the WHO Director General when they started bringing in private corporations to supplement their government funding. So that's when the Gates Foundation started putting money into them. And they became very aligned with the pharma lobby at that point. So it's the early 2000s. But Norway, if you remember, were one of the countries that's funded CEPI. So there's a link there. And then Agenda 2030 came out of, again, James P. Grant at UNICEF, the same guy who introduced universal vaccination. Because he was the director at UNICEF when they ran the Summit of the Child, and that's where the Sustainable Development Goals have come from. So again, there are Rockefeller Foundation agendas. Even Gavi, the Vaccine Alliance, is a Rockefeller Foundation initiative. They just got Gates to put the money up for it. What they've done is in the 1970s, they were overtly politically ambitious. So you had Nelson Rockefeller was the vice president in the Gerald Ford's administration when they had the first swine flu vaccine disaster program in 1976. And now they're sort of content not to be political players, but just to pull the levers of power in the background. And they very much have their tentacles into the CIA as well, because a lot of the CIA coups in throughout the 20th century were in support of Rockefeller interests. So 1973 in Chile, for instance, the overthrow of the Allende regime, they'd irritated the Rockefellers because they had nationalized a copper mine, I think it was, that they had just provided a lot of money to through one of their New York banks. So they're kind of the power behind the scenes. And a lot of the players, so Cadlick, for instance, is he's a member of the Council on Foreign Relations, as are a few of his key associates. So
that's basically a Rockefeller that came also out of the Rockefeller as well. Yeah.
And to me, it's very clear that this is a fascist project as well, because they talk a lot about public-private partnerships, but the model that they're putting forward is for the government to lavish money on private sector companies to develop these vaccines, and then the profits get privatized, and they're creating a market, a forced demand for these products through the use of these vaccine mandates, and that will become worse as the passports come back, and they start to dictate that you must have XX and X vaccine before you can go anywhere.
Okay, so one thing that we've not really discussed here, and which in a sense is kind of like central to it, is the issue about what was then SARS-CoV-2? Was there ever, a real, if it was a novel virus, how was it created? The suggestion is that whatever it was, this was a planned operation from your research, right? Was it? I mean, I can tell that our own research, we don't comment on the politics or the or even the biology of it. We simply look at the data, and from the data we've seen is that the whether or not this was a novel virus, it certainly wasn't significantly worse than the flu, and that absolutely massive those excess deaths which occurred in the spring of 2020, that most of those were more about the response to the virus rather than the virus itself, especially as the very large excess death numbers were in very, very localized places like Lombardy, London, New York, etc., where the responses were particularly bad, right? So what's your take on it?
Well, I think they've been doing something similar over a long period of time. So take bird flu. Now, bird flu is I haven't written as much about it as I would like to, but I did do a lot of research on it, and it's one of the things that Jeremy Farrar, for instance, hangs his hat on. And
people don't know. So Jeremy Farrar was the director of the Wellcome
Trust.
Wellcome Trust is now with the WHO, isn't he? He's got a senior.
Yes, he has. And he's one of the major villains in this project, particularly on the lockdown front, because I think that was a shakedown to get the government to hand over large sums of money to CEPI to finance the vaccine programs. So on bird flu, the story is that it's this incredibly pathogenic, dangerous virus that kills 60% of the people who are infected with it. And when you actually go back and look, you'll find what I found was that the Vietnamese doctors, because it started in Vietnam, the Vietnamese doctors were actually saying, well, these people were actually very poor and in poor condition when they got sick in the first place. And they were being treated very aggressively in hospitals, so they were being intubated.
Yeah, same thing.
And given
high initial fatality rate.
Yeah.
Infection fatality rate, yeah.
And bird flu happened to appear just as the US was arguing that you needed a new method of manufacturing flu vaccines, because flu vaccine is actually cultured in live chicken embryos, and it takes a long time to manufacture it. So I think it was an excuse engineered to come up with a rationale for why you needed to replace flu vaccine manufacturing. And if you actually look at what Cadlick was doing in the period in the run-up to SARS-CoV-2, in September 2019, he had Trump sign a presidential directive ordering various government agencies to come up with a plan and a budget for modernizing flu manufacturing, influenza vaccine manufacturing. And the deadline for that, get this, is the 17th of January 2020. Right. It was 120 days. I was like, oh, that's awfully convenient, isn't it?
So that was, something significant happened with the COVID outbreak around then, right?
Well, the COVID, so Moderna's vaccine design for their COVID vaccine was finalized on the 13th of January. And on the 20th of January, the WHO sent its first investigative team into Wuhan to do a field investigation, and Davos started. So Davos started on the 20th. At the beginning of that week, and then on the Friday of Davos week, just as they were breaking up, they were able to announce that CEPI was going to be financing the manufacture of the first batch of Moderna's COVID vaccine.
But wasn't that also the same date when they suddenly came out with the PCR test
Oh,
for
yes,
COVID as well?
yes.
Yeah.
I think that had actually been, he'd published that a few days before. And of course, it was that press conference took place the day after the lockdown in Wuhan. And WHO had tried for 2 days to get the emergency committee to recommend that they declare a public health emergency. And they needed this so that the Americans could then issue a PrEP Act declaration and indemnify Moderna when it started manufacturing its vaccine. And without the public health emergency, they couldn't have the PrEP Act declaration. And I think what happened in Wuhan, after the person that Jeremy Farrar blames for blocking that declaration or that advice to Tedros is Anders Tegnell, the Swedish epidemiologist. He was on that emergency committee, and he wasn't playing ball.
Yeah, yeah.
And they did try and strong arm them into this. And I think what they did was they got George Gao, who is the director of the China CDC, and Jeremy Farrar always calls him my old friend because they did their PhDs together at Oxford. And I think he did them a favour because Hatchett says that he had already reached out to Dr. Gao on the 23rd. So
okay, let's still go back to the thing. Was there a genuinely novel virus? And if so, how did it get around the world?
well, there's clearly something. I tend to think that the Americans set the Chinese up to be the fall guys for this. Even the Diffuse project, which is where the vaccine design or the design of SARS-CoV-2 is meant to come from, with the furin cleavage sites that Dr. Barrick actually wrote into the proposal. So this is the proposal that Fauci is in such trouble over because he funded it when DARPA wouldn't. And DARPA actually, there's an officer at DARPA who says, yep, this is our tech. And we're crazy enough to try and make a bat vaccine. But if DARPA had done it, we sure wouldn't have done it like this. So I think there was something, but I agree, it's not as dangerous as they've made it out to be. And conveniently, it overlaps with flu and it overlaps with common colds and all sorts of things. And you don't really know you've got it for the most part unless you do a test.
Yeah, and we've done quite a lot of research ourselves and publicizing those issues. So, okay, so we're coming to the end of the hour now. Tell me what's going to happen now. Where is this basically all going? What should we be worried about and look on the lookout for?
On the lookout, I think they're going to try and roll out a Nipah virus under an emergency use authorization. And my research into that, so Farrar again had a key role in identifying that back in 1999. And I think that was a cover-up for a disastrous vaccine program in Malaysia. Nipah causes encephalitis, or is meant to cause encephalitis. And they had a Japanese encephalitis vaccine program, and all the pigs that got sick and all the farm workers working with those pigs who got sick had been vaccinated against Japanese encephalitis. And the farm workers had had 3 vaccines. So I think there was a cover-up. But there's been a lot in the press recently about Nipah outbreaks in Bangladesh. I'm not sure if there was another one in Malaysia or the Philippines, but you keep hearing little things about it, and I think they're gearing up for that. And the first question I would have is, has there been a recent Japanese encephalitis vaccination campaign in those countries where they're having the outbreak? It just makes me very suspicious. The other thing I had a whistleblower contact me warning me that apparently the RSV vaccines have been stockpiled and they're almost out of date. So there'll be pressure to roll those out as well.
Right.
And they're under tested.
Yeah, okay.
As we know.
Yeah, well, thanks for that. I mean, so just to finish, I know I can give links to the six-part series of articles you did for the Conservative Woman website. Where can people find you and find out more about what you're doing and all of your research? Because I know that you've done a lot more than was in even those articles, those six articles in Conservative Woman.
Yeah, there are about 58, I think, on Conservative Woman. Some of them are repeats. They've been published more than once. They're there. You can find some of the articles, not as many as the smaller library, on Brownstone Institute as well. And I am on Twitter. I'm not a very prolific tweeter. I tend to just tweet when a story is coming out
But do you tweet
rather than...
links to your articles? That's the thing.
Yes, I tweet links to the
Oh, in which case,
articles.
why not give your
So,
I'll give you a Twitter handle then.
yeah, so the Twitter handle's just at Paula Jardine.
Well, thanks very much. That's a really, really great and informative interview. Thanks.
Thank you for having me, Norman. It's been a pleasure.